We're going to treat face and neck with the Aura365. We're going to do 1 to 4 layers, just depending how the skin responds. I really like that this particular peel is clear. There's no color to it, so we can really see how the tissue interacts with the skin. Because it does have less than 20% TCA with the blend of salicylic acid, glutathione, tranexamic acid, phytic acid, and a lower phenol payload, we'll be able to indicate any frosting on the surface of the skin because it's a nice clear vial. There's 5.5 mLs in a vial, so there's plenty of product to treat the face with 1 to 4 layers. So we're just gonna pause for about 60 seconds in between layers. It also comes with a peel prep pad here that will be prepping the skin with previous to the treatment. And in the peel prep pad, we have like organic aloe, witch hazel, hyaluronic acid, glycolic acid, sodium PCA, we have vitamin D, vitamin A, so there's a lot of really great prep ingredients in the peel prep pad. It's not just an 70% isopropyl alcohol wipe. So there's intention behind the prep as well as how we're going to layer on the peel. There's also dedicated booster technology with Aura365, so it can be used standalone, or you can use one of our dedicated boosters. There's 4 boosters. The booster I chose here is the Neuro Calm Booster. It's applied 2 layers post-peel, so we'll do 1 to 4 layers of Aura365 and then 2 layers of our 2.2 ml vial of Neuro Calm. We have a lot of neurogenic peptide technology in the Neuro Calm, so it will reduce any redness associated with the wound response in the skin. But remember, in our Aura365 peel, we have Dermal Smart technology, which is our neurogenic technology to soothe inflammation and the nerve endings within the tissue. So we're able to calm those nerve endings during the wound response aspect. So we also have drone delivery. Drone delivery is peptides and polymers that encapsulate our active ingredients and bring them into an area of injury. So the 2 technologies are wrapped not only into the Aura365 peel, but they're also wrapped into our booster technologies, and we have 4 dedicated boosters. We do have a acne booster called Clear. It's the only booster we would be using as a pre-treat. Then we would do our 1 to 4 layers of Aura365 because it has azelaic acid in it. Our Clear booster for acne, azelaic acid is used to as an antibacterial on the surface of the skin, reduce inflammation, and really help to clear the acne lesions pre-peel. We have salicylic acid in this peel, which is a treatment for acne. So we can treat many indications with Aura365. There's also a post booster called Tone Logic. That is for melasma, hyperpigmentation, post-inflammatory hyperpigmentation. And we have a target age booster as well that is more for fine lines and wrinkles. So can be used standalone or with a dedicated booster. I do have the NeuroCalm on hand just in case there is an inflammation response. We can calm that inflammation within 1 to 2 minutes. So I just opened the sealed vial. It's all kind of clear of oxygen. So we just opened the top here and poured it into a medicine cup. You also will be getting 2 just woven gauze towelettes. So I opened one here. They're 2x2s. I like to fold them in half and then in half again. I'm gonna load this 2x2 up with the Aura365 peel. Just doing that over here. And I'm just gonna wring out the excess. And we'll start with our application. And remember, there's a lower phenol payload in here as well, so it will act as an anesthetic. And we're just going to go ahead and treat the full area, of the face. So we can break that into zones: forehead, cheek, cheek, and then go ahead with the neck, since we have a beard here, so we have enough product for the neck. So I'm just going to go ahead with our pre-treat towelette, which is our prep. Are you ready for me?
Mm-hmm.
So application is pretty easy.
Used to be acetone.
Yeah, it sure did.
How much
Can you do
phenol
upper
is in there?
eyelids or no?
You can do over the orbital bone area,
Yeah.
so we certainly can do that as well.
When you do a series, how often do you do it and when do you decide?
Yeah, so you're going to do that about every 30 days apart, and typically we're doing 3 to 4 treatments within a 3 to 4 month time.
So that's the recommendation.
Mm-hmm. So we just want to make sure that we've treated all areas with our peel prep pad. Let's get a nice application. There's quite a bit of product loaded onto these prep pads here.
Can you smell it?
And again, I just folded my 2x2 in half twice, and I'm going to wring out the access, and I'm going to start on the forehead. So this is going forward with the Aura365 peel. Are you ready for me?
Yeah. How much alcohol is in that?
In the peel prep pad?
Yeah.
None.
It feels like alcohol.
There's glycolic acid in there. So we got a nice little flush of pink, as you can see. I'm going to just keep going on my facial zones. How's that feeling?
No problem. Feels a bit like the prep pad.
Good. On a scale of 1 to 10, how are you feeling? 10 being you want to run out of this room. 1, very comfortable.
I'm comfortable.
Good.
It stings, but it's not a big deal.
Good. So I like to wait about 60 seconds between application. Really, we're looking for any frosting, any extreme redness or anything like that associated with the wound response within the skin. Because of the Fitzpatrick skin type, he is a lighter skinned Fitzpatrick, so he'll likely pull a little bit of pink, and I noticed that on the cheek. But I'm not seeing anything where I couldn't move forward with a second layer.
So you can smell the phenol, but it's not as overwhelming as some of the other phenol pills, which is important because it can really stink up your clinic if you're doing phenol pills.
We use it to do.
Equivalent to like the VIP or like the competition for the VIP.
Yeah, so the difference between this peel and some of our other competitors, we have a blend of TCA, salicylic acid, glutathione, phytic acid, tranexamic acid, and a lower phenol payload. We've split out the retinoic acid into the post-care. So we are using a pharmaceutical grade retinoic acid, but that is during the 3 days post-care. So he's going to use one of those tonight to boost the peel, and then 2 nights thereafter. So 3 total nights, the retinoic acid is out of the actual peel. We also don't have vitamin C embedded into this peel, and we have tranexamic acid and phytic acid, which typically isn't in any of their competitive peels on the market.
Why
So-
no vitamin C and you do hydroquinone?
Yeah, so no hydroquinone here, but we do have a trosonase inhibitor for post-care that is more of a arbutin tranexamic acid blend for darker Fitzpatrick types as a pre-treat or a post-treat. Because hydroquinone is banned in a lot of countries, and since 2020 there has been a lot of information coming out about hydroquinone and its use, who can use it and who can purchase it. we aren't using hydroquinone here within Aura365. So we have some other tyrosine inhibitors that we feel are more effective to go along with the intentions of this peel.
Good.
All right, are you ready for your next layer? So
Yeah,
he's
the
got a nice
burning,
little
yeah.
flush of pink, and then how are you feeling on a scale of 1 to 10?
1. The
Yeah.
burning is stopped. So
Yeah, so
I just feel just a slight tingle in my
Yep, so
cheekbones. That's it.
yeah, and we have a higher percentage of TCA, that less than 20%. However, he is really comfortable. If we did a straight TCA without the Dermal Smart technology, so we're utilizing those neurogenic peptides to calm the nerve endings within the skin along with a lower phenol payload, it is quite comfy for application, especially when we're using a higher concentration of TCA. So we'll go ahead with our second layer. What I like to do, since we put the majority of the peel on the surface, on the top part of the skin, because I loaded up my gauze, I'm gonna actually treat from the bottom up on my second pass. How's that feeling?
That's fine.
Good. And pretty easy to apply. I mean, typically I wouldn't be, chatting to you all during the application. It would take about 10 minutes between layers.
So I see you treated the neck. Can you treat the décolletage area too?
Yeah, so it can be actually treated, utilized on any body area other than the underarms or like the pubic area. So underarms, because it's TCA, you wouldn't want to use it on the underarms. There are dedicated peels for hyperpigmentation on the underarms or the pubic area, but it isn't good to use Aura365 in those areas because of the TCA. So
What does the TCA do?
So the TCA is more for collagen production and fine lines and wrinkles. We're utilizing that, and TCA just isn't good to go into the follicles or your sweat pores on your underarms. So some people are looking for something to treat hyperpigmentation in more intimate areas in the underarm, but the Aura365 wouldn't be in particular to be used there. It would be a contraindication.
Okay.
How you doing?
I'm doing fine.
Good. So any body area, acne on the back, TCA can also be helpful for some scarring areas, but sometimes a combination therapy with microneedling would be a better aspect for scarring or radiofrequency needling. You just want to make sure that you're never doing these treatments within the same day. These are done 30 days apart. Because this is a mid-depth chemical peel, it's going into the papillary layer of the dermis. It is a medical grade treatment, therefore you want to at least wait 30 days between any other medical grade treatment. So radiofrequency microneedling is great for scarring, but the TCA would also be helpful. And then we have the blend of our antioxidants and our pigment modulators embedded in here, so we can treat acne, fine lines, wrinkles, hyperpigmentation, melasma, all of the things with the peel. So you can decide on combo therapies on which one you would want to do first. If your patient is more concerned about scarring, maybe we would start with microneedling, and then 30 days later we're going to be treating pigmentation, post-inflammatory hyperpigmentation, melasma, acne, or any of the other things with the peel. So we can really combo it into any type of therapy as long as we're doing that 30 days apart.
How about a LED light?
An LED light, so LED could be used after the post-care would be my recommendation. So we just want to allow the peel to do its mechanisms, and we're utilizing the post-care over the next 7 days. So post that 7 days, they could go back to their skincare regime. A lot of people are using LED, near infrared or red light LED as a home care. It would probably be best to start using that after their post-care kit was completed and that 7 days post-peel. That would be my recommendation. All right, so we're going with the third layer. I think everything looks good. I don't see any frosting. I think he's having a really Very nice response in the skin. It's not too red. He's got a nice little flush of pink. You ready for me?
Yeah. The second application didn't really, it burned a little bit, but not much at all.
Yeah, in the second application, the phenol will be sort of taking place as that anesthetic, so. And then along with that, Dermal Smart technology, our neurogenic peptides, really calming the nerve endings within the skin. I took some great before pictures, and I'm here all weekend, so every day I'll be getting some after photos as well, documenting the process. All right. So you could have a fan if you wanted to, a little handheld fan if you had a patient with some discomfort. On a scale of 1 to 10, typically we can get some of our patients to a 3 as far as the pain level, so it can feel a little bit uncomfortable, but a handheld fan works really well. They can just hold on to it when they felt like they needed to.
This one burning more than that.
A little bit more, yeah. You're getting a little more flush. Yeah. So I think we can go with the full 4 applications here. So some people, you know, we see some frosting. And if we saw frosting in an area, say it was on the upper cheek, then we wouldn't just treat that particular area. So we could treat the rest of the face, just not the area where the frosting is happening. There's 2 levels of frosting, like it's a little bit different look of frosting on acne. That's more the sebum within the follicle reacting to the salicylic acid, not necessarily the TCA reacting with the tissue. So we're looking at 2 different frosting levels. Sometimes with acne, we just see it around the acne lesion. That's okay to treat over. But if we saw an area, a large area of white, that frosting is due to the TCA for anti-aging. So we wouldn't want to treat over that area.
So far, no frosting.
What's that?
I said, so far, no frosting.
No frosting. He's doing great.
Tough skin.
Yeah.
They got it.
So nothing will be applied to the skin. We're just going to allow the peel to penetrate, and he will be washing his face after 4 to 6 hours. We do have a post-care treatment kit, and I'll go over that here after we do our final application.
So in his case, because he's not really complaining a lot, you don't have to use the other neurogenic.
Yeah, I mean, I still can, because I actually want you guys to see the, just to show how it will reduce the redness. So what I'll do is I'm going to let this sit for a couple of minutes and then kind of explain the post-care kit, and then we'll go ahead with the booster, 2 layers of the booster. It'll just take the redness down. It's not going to affect the efficacy. It's just going to reduce the inflammation even further, so he won't be so pink. Yeah, I did 4. So that's the entire bottle. So there's 5.5 mLs. 4 layers does the entire bottle, which is really nice. Yeah, it goes a long way. Sometimes we get 2 layers on a patient because they fully frost. It just kind of depends on their skin condition coming in. But the kit is very nicely laid out. We took one of the products out, the cleanser, because our demo model washed their face before the procedure. But within our little box here, we have post-care instructions for the patient. And like I said, there's not retinoic acid in the Aura365 peel. However, we have a pharmaceutical grade retinoic acid wipe that they're going to be using the night of the peel. So the way that the post-care works is he's going to wash his face with the Clean Slate Cleanser tonight after 6 hours, and then he's going to go ahead and use his first Precision A wipette. Nothing else, just go to sleep with the Precision A wipette. When he wakes up the next day, cleanse with Clean Slate Cleanser. We have a lovely Aura Lock Balm, which has a lot of hydrating qualities, antioxidants, 1% hydrocortisone within the Aura Lock Balm. Sorry, I grabbed the wrong one. Right here, Aura Lock Balm. Right here. So he'll be utilizing that and our SPF, which is our Shield 365. It is a pure mineral-based sunscreen. It's good for all Fitzpatrick skin types. It's not white or chalky. It just really absorbs into the skin. There's no tinge of color to it, so it's really nice for all colors of skin. It's really nice for that. And then, so he's gonna just use that for the next 2 to 3 days during the day, and then we're going to be doing our Precision A wipes on the night of day 1, 2, and 3. So it's pretty easy little setup for post-care. On day 4, if he starts seeing peeling, we have an Aura enzyme mask, which is a papaya and pineapple enzyme mask. You can utilize that just to dissolve or decay any of the peeling, muck on the surface of the skin. And then you would just apply your Aura Lock Balm and your Shield 365. So it's a really easy system, and it's put together really nice for a 7-day post-care. So a week post-peel, they'll be just using these products. They can go back to any of their skincare regime after the 7 days. So if they're using any prescription strength products, just under their physician's orders, they can go ahead and use those after 7 days. So pretty easy. But notice his skin has already calmed down as that peel has absorbed into the skin, and we're allowing that Dermal Smart technology just kind of do its own work, which is going to be very anti-inflammatory. Normally, we can see from some of the traditional chemical peels, we were talking about the blue peel, the Obagi blue peel, how the skin can be very inflamed and detached and very itchy, red, and all of the things during that 7 days, 7 to 10. I want to say the blue peel is kind of a longer process for healing. But with this one, it's quite comfy. It can be done any time of the year. We can also apply a sunscreen, but I'm going to do 2 passes of the NeuroCalm Booster. So I'm going to get a fresh medicine cup here and new gloves.
The burning's just about gone.
Good, yeah. And that's due to our peptides that we have embedded into the Aura365.
They have permanent makeup. Can you do it over or no?
Permanent makeup, I don't think it's a good idea just because of the TCA. So we probably want to skip that area if it was in their eyebrows or lips. Just gonna grab a new medicine cup here.
He's probably gonna peel in a couple of days, right?
What's that?
He's gonna peel in
Yep.
a couple of days.
Yep, a few days. It can go by pretty quick. Obviously, it starts normally on the movable parts of the face first and kind of works its way up. Yeah. So there's 2.2 mLs in our booster. It's enough for 2 passes. Sometimes with gloved hands, it's harder to open those little tabs. So.
Do you work with Dr. Song?
Yeah, no.
I
But he's
wish.
always said he'd like me to.
And where are you from?
I live in Boise, Idaho.
Okay.
Yeah.
Far from him.
Yep.
It's really easy to do. I have some great estheticians that
Yes,
do this all day
yes,
long.
for sure.
And that's the great thing about this. You can delegate it. Doesn't take much time.
How often per year could you get this done, or is it preferred?
Yeah, so I would say 5 times a year would probably be because of the TCA and everybody wants to do other combo therapies. So just spacing those out 4 to 6 weeks.
So there's no harm.
Yeah,
there's no harm doing
no harm.
it. So microneedling in between.
Yep, for combo therapies, 4 weeks apart, about 3 weeks apart. All right, so we're gonna go in with the NeuroCalm, even though he's pretty calm. I mean, he's got some redness on the chin, or on the neck area. So we're gonna do this in 2 layers. So a little bit different, somebody was asking about some differences between this peel and some of the other competitive peels on the market. One thing we're doing is we're not utilizing our boosters together, so they're not dumped into the peel cup. They're all used separately, so they're used as a pre-treat or they're used as a post-treatment. All right. And then how did that feel for application? Any activation? Yeah. So NeuroCalm is very calming. It's all in the name. So there shouldn't be any activation feeling. Like a lot of the time when you use a chemical peel and they don't feel like they're getting a lot of redness or frosting, the first thing the provider wants to do is go wash it off. So really this has already absorbed into the skin due to the technology. We have the neurogenic technology that I keep speaking of, but we also have the drone delivery. So special peptides and polymers that are grabbing on to the active ingredients and delivering them into a depleted collagen zone or into the papillary layer of the dermis. So it's not a strip and peel method, right? It's not on the surface of the skin. We can't just wash it off. So we're just gonna allow everything to absorb and interact with the tissues as they should. And notice the redness on his cheek already going away because of the peptide technology. And I have a list of the peptides that we're using here in our clinical training manual. We're also going to be in the exhibit hall. So any really precise information you all would like on ingredient decks, I'm happy to go over those with you as well. So this booster can also be used for any inflammatory treatment that you're doing. So the booster could be used potentially standalone because it is anti-inflammatory. So if you had some treatments that you're doing where you had some pretty inflamed patients, this NeuroCalm would take that inflammation down within a couple of minutes. So it's really nice to have on hand, but it works specifically with the Aura365. So no washing the face. Remember, there is a lot of active ingredients on the face. So we have to remind our patients not to touch their face and touch their eye, or touch their face and touch, their significant other or their children or their pets. So if they touch their face, they just have to make sure that they wash their hands, but they have to pay attention that this isn't going to be washed off for about 6 hours. So anything that they come in contact with, they have quite a few active ingredients on the surface of the skin just to keep everyone safe. But yeah, so that's the full application. Once this dries, I'm gonna put the Shield 365 sunscreen on, and it absorbs really nice. It's non-greasy formula. So it has about an SPF of 30 with embedded into it, and it is a pure physical sunscreen. Can I? Oh, it's right here. There's a little seal on here. Will you help me?
Yeah, sure.
I wasn't able to get the other one off. I don't know if you can. I have pointy, more pointy nails than I say yours. She's got.
Dr. Salk, you said you could delegate this type of procedure to others instead of the medical assistant.
Yeah, medical assistant, esthetician.
Those would be okay.
So, it's going to vary from state to state. Are there any states that kind of regulate estheticians from doing?
Yeah, it'll vary from state to state whether the provider can delegate to a nurse or to an esthetician. So you just have to make sure that you know what your regulations are. Most states, providers, doctors can delegate to an esthetician. However, some other states are set up where the provider has to dedicate to a nurse on our end.
And some states will make sure they say that the physician has to be on site, even if you do have somebody else doing it.
Yep. So some states, physician, again, has to be on site, but also other states, physician doesn't have to be on site, so.
What are the components that make it medical versus
Yeah, it's the
mass efficient?
absorption rate, so this is a 1.0 to 1.7 pH, and the ingredient blend. So we are using a higher percentage of TCA, and that TCA is absorbing into the dermal tissue. So anytime we're doing something in the dermis, it's typically a medical procedure. And this one actually is going into the papillary layer of the dermis, which is the mid-dermis. So that's what would make it medical grade. So some estheticians can microneedle when we're talking about microneedling, but they can only microneedle at a certain depth, and that is in the epidermis. So microneedling is always like an interchangeable word, where I feel like that should be more called nanoneedling than microneedling. Microneedling is typically in the dermal tissue, which would make it a medical procedure.
And you would not microneedle with this at the
Nope,
same
you would
time.
not microneedle in the same day. You would want to make sure any procedures that you're doing were 30 days apart. So a nice little layer of sunscreen. It's very non-greasy, has kind of a matte finish to it, which is nice, absorbs into the skin, and he's ready to roll.
That's it.
For the day.
Thank
yeah.
you.
Thank you so much.